Welcome back to the Deep Dive. Today, we're taking a seemingly simple, almost cliché childhood mishap, the bicycle spoke injury, and we're going to peel back the layers.
We are.
Because what our sources reveal is, well, it's a surprisingly complex, high-stakes, medico-legal battleground.
It's one of those things, isn't it? Everyone hears bicycle accident and just thinks, oh, a scraped knee.
Right.
But the stack of research we've looked at today, it tells a fundamentally different story. We're talking about an incident that, can require complex orthopedic surgery.
Wow.
It can lead to permanent physical disability, and it very frequently results in major litigation, both against caregivers and medical providers.
Exactly. So our mission in this deep dive is to synthesize the clinical, forensic, and legal documents to really understand why this specific common accident graduates almost instantly from a simple injury to a high-stakes challenge.
And it all comes down to the hidden nature of the trauma. We have to start by clearly defining the mechanism because that's what dictates the severity. The injury happens when a child, typically riding as an unauthorized passenger.
So sitting on the handlebars or the crossbar, that kind of thing.
Precisely. They're sitting precariously and their foot or lower leg gets caught.
And then what happens?
That foot is then violently crushed between the rapidly moving wheel spokes and a fixed point, like the bicycle's frame or fork.
That compression, that crush force, that's what changes everything.
It is.
Because the central sort of terrifying conflict here, and the reason it's so litigious, is the deception.
A deception, yes.
These injuries often present initially as really minor, just a bruise, a graze, maybe an abrasion. But the damage underneath is catastrophic.
The clinical danger is that the surface appearance it gives you a false sense of security. The visible scrape is just the wrapper, so to speak, around a potentially devastating crush injury.
So let's jump straight into that hidden reality. Segment 1, the clinical severity and long-term impact. When we look at the source material, the key finding is that we are not dealing with a cut, a laceration. This is pure compression and crushing of soft tissues.
That's right. The sheer force exerted as the spoke meets the fork, it essentially shears and compromises the tissues. Our research specifically and repeatedly flags the resulting soft tissue damage, particularly the risk of skin necrosis.
And necrosis is tissue death, right?
It is. It's tissue death, and it's shockingly common in these cases.
And where exactly is this necrosis occurring? Is random?
No, it's highly focused. Because of the mechanics of the bike frame and the ankle structure, it frequently occurs near the bony parts of the ankle, specifically the lateral or medial malleolus.
What most people would just call their ankle bone.
Exactly, the ankle bone, or critically, near the Achilles tendon. The skin there is already stretched thin over bone and tendon, making it extremely vulnerable to that crushing force cutting off the blood supply.
That paints a vivid and scary picture. The tissue is essentially dying because the blood supply was cut off in a fraction of a second, but you don't see the full damage for hours, maybe even days later.
Which is why vigilance is so crucial.
But it's not just soft tissue, is it? We need to talk about fractures.
Absolutely. While the soft tissue crush is the dominant clinical concern, about 1 in 10 of these cases, so approximately 10%, involve significant fractures.
And what kind of fractures are we seeing?
Most commonly in the toes, but we also see fractures in the main lower leg bones, the tibia or the fibula.
A 10% risk of fracture makes this a high alert situation in any emergency room. But again, it seems the biggest risk, the one that leads to the worst outcomes, is that undiagnosed severity.
That's it.
Why are these underlying issues so frequently missed?
Because the initial presentation is so misleading. I mean, think about it. A dizzy doctor sees a child with an abrasion, minimal, immediate swelling. Their suspicion level may not be high enough.
So they just clean the scrape.
They might clean the scrape, maybe take an X-ray focused only on the obvious injury site and send the child home. But if that underlying tissue necrosis isn't recognized, or if a hidden fracture goes undiagnosed,
the outcome can dramatically worsen.
Dramatically, potentially requiring complex skin grafts or even amputation down the line.
So the diagnosis failure is often tied to looking at the superficial injury rather than understanding the crushing mechanism.
Precisely. The medical imperative here, based on all the literature, is you have to treat the mechanism, not just the surface abrasion. You must assume a severe, deep, soft tissue injury until proven otherwise.
And the sources are very clear that the impact isn't just about the immediate recovery. We need to touch on the long-term sequelae.
Yeah, discussing the long-term sequelae, the lasting, sometimes permanent impacts, is sobering. It's not just a quick 6-week recovery.
I imagine not.
Our sources indicate that not all children recover fully within a year. And beyond the obvious need for reconstructive surgery to fix permanent physical scars from necrosis, what is often overlooked is the psychological layer. Some children suffer significant long-term behavioral and emotional problems linked directly to the trauma of the accident. It's an innocent ride that turns into lasting trauma.
That adds a whole new layer of complexity. It means the medical response needs to be holistic, recognizing both the physical and the behavioral recovery path.
It does.
It really seems like the physician's primary challenge is overriding the visual evidence and treating the injury with maximum suspicion.
That is the core takeaway from the clinical side. You cannot afford to miss the underlying crush injury, especially because that misdiagnosis is the direct pathway into the next major area of concern, the legal system.
That sets us up perfectly for segment 2, navigating the legal landscape of liability.
Right?
The sources explain that when these injuries turn severe, the resulting lawsuits, and there are many, generally fall into 2 distinct and, frankly, messy categories.
What's fascinating here is how often the legal focus shifts away from the bicycle manufacturer and lands squarely on negligence. Liability is frequently split between the people supervising the child and the people treating the injury.
Let's break down that first category, which I think affects every listener who is a caregiver. Parental or supervisory negligence.
The definition of this category hinges on the failure to use reasonable care to keep a child safe. If a parent or guardian allows unsafe riding practices,
Like letting a child ride double.
exactly, like that, and fails to use readily available protective measures, they may be found liable in certain jurisdictions if harm results.
That sounds highly subjective.
Right.
I mean, what constitutes reasonable care must change over time.
It does, but the source material cited a very specific, almost shocking standard that is starting to crystallize in this domain. It's the most compelling legal detail in the research. The sources point out that as recently as 2026, there are explicit consumer warnings appearing on products that are now framing these spoke incidents as resulting from negligent parent.
Negligent parents, that's strong language.
It is. The negligence cited is specifically the failure to install cheap, standard protective spoke guards or covers, or allowing those unsafe riding practices we mentioned.
That's a seismic shift. We are moving from viewing this as a sad, unavoidable accident to seeing it as a foreseeable and preventable oversight.
That's the key. The failure to use a simple plastic spoke guard is now being explicitly framed in legal terms as an actionable oversight that directly caused the injury.
It turns an accident into a liability.
It really does. It raises a profound question about the standard of care for everyday parenting. If a specific protective measure is inexpensive and widely available, and its absence leads to a known specific injury.
The legal system is increasingly arguing that failing to use it meets the threshold of negligence.
Precisely.
So that's the caregiver side. But the second major category of lawsuit is equally critical: medical malpractice. This connects directly back to the clinical deception we just discussed.
It does. If the injury looks minor but is secretly severe, it creates a massive vulnerability for medical practitioners. Claims against doctors often stem from those critical misdiagnoses or improper treatment that happen in the first few hours.
Can you elaborate on what the legal system identifies as the critical mistake here?
The critical mistake, in legal terms, is the failure to appreciate the true depth and nature of the injury. When a doctor dismisses the injury as a simple abrasion, they are failing to diagnose the underlying issues, the severe hidden skin necrosis that will show up days later, or the undiagnosed fractures that compromise the limb.
So it's a legal argument for a higher standard of diagnostic suspicion whenever a patient comes in with this specific mechanism of injury.
It is. And if we connect the two categories of liability, parental and medical, the unifying theme is prevention.
The spoke guard.
The absence of adequate spoke guards or protective covers is consistently cited as a major risk factor in both legal case analyses and forensic medical evaluations. It's the simple measure whose absence underpins so much of the subsequent risk and liability.
Okay, this brings us to segment 3, which is all about the practical side for you, the learner: deepening the search and essential documentation. If these accidents escalate to legal or compensation claims, you need airtight proof.
And this is where medico-legal documentation becomes the bedrock. The sources stress that to successfully prove the causal relationship between the accident, the crush mechanism, and the subsequent long-term damage.
The necrosis, the fracture, the emotional trauma.
Right. To prove that link, the documentation must be utterly impeccable.
Beyond the standard medical chart, what specific proof elements do the sources emphasize are required to establish that causation?
Two specific requirements repeatedly surface in the forensic literature. First, high-quality, detailed photographs of the injury taken at the earliest possible stage.
And then more later, I assume, to show the progression.
Yes, periodically after, to show the progression of necrosis. And second, a detailed reconstruction of the accident. This reconstruction, whether it's a diagram or a written narrative, is essential for proving how the crushing mechanism occurred.
To establish that direct link.
A direct link between the parent's action or inaction and the injury's severity.
Now, this is the part of the deep dive tailored specifically for you, the person who needs to get smart on this subject fast. Our sources didn't just tell us what to research. They provided the precise, high-yield search terms that researchers and legal pros are using.
It's the ultimate shortcut to knowledge. Think of it as the research metadata. We are essentially handing you the keys to the most relevant academic work.
So what are we talking about?
Well, if you need clinical papers focusing on the immediate trauma, the recommended search terms are things like bicycle spoke injuries, children ankle fracture,
Okay.
or pediatric bicycle spoke injury soft tissue grading.
And for those seeking literature on the most severe, often litigation-sparking complications.
You would use a phrase like bicycle spoke injury compartment syndrome case report.
And compartment syndrome, just for our listener, that's a massive medical emergency.
It's huge. Pressure builds up in the muscles. It can require emergency surgery to save the limb, a direct and severe result of a crush injury.
And there was a specific set of search strings for anyone interested in the technical orthopedic risks involving children's bone growth.
Absolutely. To find papers focusing on pediatric bone development, you should search bicycle spoke injuries, discal tibia, fibula, Salter-Harris.
Salter-Harris.
That last term, Salter-Harris, points directly to papers discussing growth plate fractures in children, which can have lifelong implications for bone development.
It's impressive how concentrated this knowledge is.
Mm-hmm.
And these papers aren't just scattered randomly online. They are clustered in specific academic venues, correct?
That's right. While you'll start on foundational databases like PubMed and Google Scholar, the actual content is highly concentrated in specialized journals, so your search becomes extremely efficient.
Where should people look?
Look specifically at the Journal of Pediatric Orthopedics, Pediatric Emergency Care, and the journal Injury Journal of Trauma. Those are the publications dedicating resources to this exact mechanism of injury.
And finally, there was a great practical application tip the sources provided for managing all this academic data.
Yeah, it's a point about organization and professionalism. When researchers find that relevant articles say a huge retrospective study of children with spoke injuries, they are advised to immediately use the cite function in databases like PubMed.
What does that do?
This function exports formal citations, usually in formats like Vancouver or APA, which you can drop directly into your notes, legal briefs, or institutional guidelines. It keeps the research instantly trackable, standardized, and ready for a medico-legal report.
That is fantastic advice for ensuring integrity and consistency. We've covered a remarkable amount of ground today. I mean, we've gone from the simplicity of a childhood bike ride to the complexity of a legal and clinical fault line.
Indeed. The central finding remains stark and clear. A seemingly minor childhood spoke injury is, in fact, a severe medico-legal nexus.
It demands this sharp clinical vigilance to spot the hidden damage.
And it now requires clear supervisory responsibility from caregivers regarding those preventative measures.
The legal sources make it impossible to view basic bicycle safety the same way again. It's about the ever-tightening definition of reasonable care in a world where preventative tools are cheap and knowledge about the injury is widespread.
Which raises the final provocative thought for you to consider based on the source material.
Okay.
If consumer warnings in 2026 are explicitly labeling the absence of a simple protective device like a spoke guard as evidence of parental negligence, how far should the requirement for reasonable care extend in preventing every other commonplace childhood injury?
That is the line we are all navigating. Where does the unfortunate random accident stop, and where does preventable oversight begin? Something to mull over the next time you look at a bicycle tire.
And thank you for diving in with us.
We'll see you next time on The Deep Dive.